Terrific. All right. We have we're sort of rounding home here on the journey from compliance through patient access, payer to payer, the app marketplace, what's happening on the Da Vinci side of things, and the various IGs and opportunities for the community to get engaged, to payer and provider collaboration. So we're lucky to be joined by two guests here, Paul Kamel from Oscar and Matt Tang from CVS Health. Paul is the Senior Director of Product Strategy and Partnerships at Oscar. In this role, he splits his time between new product strategy assessments and unearthing and evaluating key product partnerships. Prior to his time at Oscar, Paul spent 6+ years leading the healthcare analytics group at McKinsey & Company and focused on value-based care analytics and payment reform, largely for state Medicaid departments. And then Matt Tang, who Matt has a diverse background in healthcare spanning patients, providers, and payers. Matt focuses on the evaluation and execution of innovative partnerships for improving health outcomes by leveraging these advanced analytics to deliver more personalized and seamless interactions for all constituents across the healthcare spectrum that are involved in the stages of the health journey. So two guys that are very well positioned to help us navigate this discussion. The format that we're going to maintain here, we'll ask Paul to go first and share some thoughts and some materials. Matt, you can pick it up right whenever Paul wraps up, and then we'll come back in and have a conversation, some Q&A, and this session is for 30 minutes, so we'll go from 4:30 to the top of the hour.
Awesome.
Great, thanks, Paul.
I'm just going to jump in then.
Jump on in.
Thanks for the intro, Nolan. Thank you for having me and Matt on the panel. And it's been a great day so far. So hopefully we can keep it flying. I'm Paul Kamel. So as Nolan mentioned, with Oscar, I've been with Oscar for 2 years on a really exciting journey as we're trying to disrupt healthcare in our own way. I was persuaded strongly to bring slides. I was hoping not to, but I will share my screen and walk you through a few pages. And just give me the thumbs up when you can see that.
We can see you.
You're good? All right. So before I talk about payer-provider collaboration and FHIR, just 1 minute on Oscar. Some folks might not be familiar with us. We are a health insurance / health tech company. We have been around for almost 10 years now and really came about as part of the ACA. And our mission is really to make a healthier life accessible and affordable for all. That's a very ambitious mission, but every year we make progress on that front. I think most recently with our virtual primary care and free incentives, we really see this being brought to life. We describe ourselves as the first health insurance company built around a full stack technology platform and a relentless focus on serving members. When I say full stack technology platform, I mean that in the literal sense. There's very little in the Oscar ecosystem that is not our homegrown software, whether that's our core claims adjudication system, the CRM that our care guides use, the EHR that virtual primary care providers use, our care navigation, our digital experience, and so on and so forth. And then the way we really see the world is building engagement and building trust with our members such that can drive value. And so, through that trust and through that engagement, we can connect deeply with members. We can trigger specific interventions. We can collect data that we can use to help them navigate a very complex healthcare system. We can deliver care ourselves with our affiliated virtual primary care practice. And then last but not least, we still have all of the insurance capabilities in terms of innovative plan design or dynamic incentives to really support the virtuous cycle, which creates more engagement and trust. So that's the backdrop of Oscar and how we see the world. As it pertains to payer-provider collaboration with FHIR, I reflected on a few things that we've learned that I'm going to share. And just generally speaking, I think we're still very early on in the journey. We think it's a very exciting journey. The innovation and consumer-centric capabilities that will arise from this are very exciting. Some of the things that we've learned is we've tried to establish FHIR collaborations with different providers are as follows. As with a lot of things in healthcare, aligning incentives between all parties is really important. Oscar broadly partners deeply with our provider partners. We are mainly a narrow network product, and that is built around specific provider partners. So we already have a good start on that front, and going forward even more today, we are building and developing value-based care arrangements. And this is critical because the things that we care about and the member cares about and the provider cares about all come together. And that feeds nicely into the next bullet, which is focus on value creating use cases. There's an infinite amount of things that we can do as we create standards and open up the exchange of information. And when we look back 50 years from now, we will have accomplished those million things. As we're starting, it's really important to pick and choose those use cases and recognize that people see the world slightly differently. I think it was Alex that alluded to some actors in the system have some concern or some reservation in terms of what the impact of this is going to be. And it's important to be thoughtful on that front. What really helps payer-provider collaboration is to simplify and not complicate. So what this means in particular is, providers operate in a multi-payer environment and a multi-point solution technology environment. And if you are a payer that's coming to the table with another proprietary capability, another proprietary point of care tool, there is a barrier to overcome in that. And if you come with a tool that's more broadly applicable beyond your own, the payer membership, there's a better opportunity for them to be able to deploy that in their workflows. The other sort of somewhat related point, but distinct, is that we believe, particularly now, it's important to meet providers where they are. There's various reasons why different organizations are at different places, and some of them might have, FHIR capabilities. They might have a technology team and they might be able to support various integrations or APIs. Others might choose to do everything through their EHR, and others might have purchased a third-party solution, a point of care tool, et cetera. And at least where we stand right now, we are open to being able to meet providers where they are. I think we definitely want to measure and contrast different options and understand, the ROI and the adoption and the consumer experience. And I think over time we'll have a better understanding of, the efficacy of different paths. But as of now, I think we're open to different modes of collaboration. Invest in learning. This is early innings and it's very complicated. Despite having a standard, there's EHR nuances, there's, partnership specific nuances, and we're still in that process. And as we build those capabilities, we also want to work with our provider partners to share those learnings. And again, I think that's going to be a catalyst for increased collaboration. And last but not least, we think it's critical to partner effectively with different health tech organizations. I contrast this with, the slide I shared 2 slides ago, where Oscar is a full stack technology platform. But the dynamics of healthcare have shifted a lot in the last 5 years, and there's a tremendous amount of high caliber, innovative organizations out there. And so we believe that it's really important to partner with the right ones. I'm very excited to be here with Nolan and the OneUp team. We are partnering with OneUp for our interoperability needs. But beyond that, I think that's really going to help decrease barriers to collaboration when there's common infrastructure and common ground that you can leverage and sort of turn on different use cases quite easily. So I'll pause there. Matt, we'll hand it over to you, and excited for questions at the end.
Okay, great. Let me see. Getting used to Zoom. Can everyone see my screen okay?
Yes, we can.
All right, fantastic. Well, it's an absolute pleasure to be here with everyone today, and I'm glad to be paired up with Paul as part of this panel discussion. We had a chance to connect yesterday for the first time and realized that a lot of our objectives are very much aligned in terms of what it is that we're doing. It is really energizing to be surrounded by this community, and I'm hopeful that we can continue to drive the momentum coming out of this virtual health conference. So I'll just give you all a little bit of a background in terms of what we do here within the Analytics and Behavior Change Division here at Aetna. But I'll start at a very high level with what is our overall mission as a healthcare company, and at the end of the day, that is to really join our consumers in their pursuit of their health ambition. And you could tell even during Paul's presentation, I think we're all kind of chasing the same goal here and want to deliver on that same type of experience. When it comes to really joining the consumers, our analytics organization really plays a central role in driving the advanced analytics efforts to accelerate our ability to deliver on that objective. And so in terms of what we do within analytics and behavior change, it's very much synonymous with the name. We have a two-part mission. How do we continue to enhance and invest in the development of advanced analytics capabilities, artificial intelligence, to really integrate and drive the insights and efficiencies into our business operations and the way that in which we engage with our consumer. And then more importantly, we constantly talk about being consumer centric. And so at the end of the day, it's really about the application. So how do we really bring that into fruition through the behavior change principles that are going to help give the appropriate information to the consumer at the right time, at the right place. And throughout the rest of today's conversation, I think we all heard a lot about kind of practical value, making sure that the information is truly insightful and actionable. And that's what we're looking to do here. So I'll kind of shift to our next slide. So in terms of, what are the 6 key areas that Aetna as an organization is focused on to really help our consumers achieve those health ambitions? It's one, we're looking to develop a deeper understanding of the consumer and really breaking down those historical data silos, which makes us really excited about FHIR. The second is around multimodal engagement strategy. So what can we do to really leverage FHIR to create more of that seamless experience? In doing so, trying to kind of put that all together and really drive tailored offerings to enable a truly holistic care model or care coordinated care model. And then really putting our consumers at the center of that and always putting them first. And similar to what Paul alluded to, is realizing the changing dynamics in healthcare is that we're seeking to engage in groundbreaking partnerships with very consumer-focused companies. When we think about what it is that we're doing here, a lot of the focus at the end of the day is on the consumer, and folks are probably wondering, well, Matt, this is a session on payer and provider and how we're going to really integrate with FHIR. And so we think of providers very much as a consumer. They play such a critical role, not just in the patient consumer journey, but they themselves are also consumers in terms of the way that they're going to be receiving information and how they can act on that information. And so at the end of the day, in order for us to be able to really position all stakeholders within the healthcare ecosystem to drive better health outcomes, it really does involve a holistic approach. And so as we think about how we continue to engage with our provider community, something that came up earlier, I think during Stephen Posnak's session, where he talked about how, fax is still a primary mode of communication. We're looking to really, accelerate the transformation beyond that, and trying to do so in ways that we're seeing in other parts of the consumer industry, leveraging of applications, and trying to also do that for the provider community. And what Paul alluded to a little bit earlier as well was around kind of that multimodal, meeting providers where they are. And we realize that there are going to be some providers who are kind of self-selecting their own population health tools, add-on clinical decision support platforms that sit on top of their EHR, or some are going to rely purely on their EHR. And so it's really critical for us to really think about, what's going to work best for them in the short term, and then how do we think about kind of where the future holds. Ultimately, at the end of the day, when it comes to the provider messaging and how we share the actionable insight, it's really critical to think about kind of, your traditional who, what, when, where, and how. And that's really important as we think about the way that we've sought to engage our provider community. Rather than boiling the ocean, we really started with kind of a use case driven approach, and trying to get very tactical about, how do we frame up the different features, what we could potentially enable, and then identifying very specific metrics and actions that we're looking to achieve, and really testing that to understand in the current state, what could we deliver on in the short term, and then how could we continue to accelerate and maximize that impact going into the future. So the way that we go about that, it is a very collaborative process. I think what we all have realized as part of the FHIR journey is that we're all still very much learning, and so ultimately we're continuing to try and figure out how to best partner with those providers, really take those lessons learned, whether they're good, bad, and really use that to inform how we continue moving forward in our partnership with our provider partners. So I think another point that I didn't bring up earlier was, another point that I wanted to bring up is around kind of remarks earlier around the information, the data that health insurance or managed care organizations do have. We're going to have historical claims data that we think is really critical for sharing with our provider partners. And so some tactical metrics are around history of medication adherence, information around open gaps in care, and how do we really share that information with our network of providers that's going to be actionable to them, allowing them to really work within their within their integrated workflow. At the end of the day, as we continue to partner on all of this, our objective really is to drive better health outcomes. We think there are really 3 areas of value that we expect to come out of all of this, and it's going to be improved patient experience, because it's going to create that seamless patient journey. It's going to reduce a lot of burden for our provider partners, and then ultimately driving overall health outcomes that will come with that.
That's great, Matt. Thanks. Is that the wrap up?
That's the wrap up.
All right. Thank you. You left me hanging there for a second. Well, great. So thank you guys. A couple questions have showed up, and then I probably have 1 or 2 I want to direct us to first, which is Paul, you mentioned at the beginning aligning incentives and that being really fundamental. Maybe either doubling down on that or in addition to that, how do you encourage your provider, the providers in your networks to collaborate with you? And what have you seen that gets them more willing to do so than not?
So I think generally providers are really excited to collaborate and partner with Oscar. I think we bring a lot to the table in terms of technology capabilities, and then our focus on member experience, and sort of that aspect to it on the consumerization front is really exciting. And so I think we are often seeing providers that are interested in that component, right? I think clinically providers know exactly what to do. And, when they're seeing patients that like, we're not in that mix, it's like when the patient leaves the office and, the provider needs them to do certain things or adhere to certain things. There's a lot of value that we as a company that has that deep relationship with that patient can bring to the forefront. And, we can do that as a payer partner, right? And how can we align our care management programs to theirs, or how can we provide them with the right information? Or if we know our patients are searching for things in the app, how can we let them know? So I think there's things that we can do that are really value add. And then I think quite interestingly, in the last 3 months, we sort of announced that we want to bring our platform to payers and providers. And so how can we collaborate with them by offering all of the things that we have? I think that's an exciting avenue. So we definitely get a lot of traction and inbound and excitement. And as like all things in life, it's a question of prioritization, and there's 1,000 things we can do, and so I think we have to be selective. But overall, I think there's a lot of opportunity for collaboration beyond just the incentive component. But that's also really required, right? Because we are a newer payer. I think we have 500,000, just over 500,000 lives. I think Matt on the CVS front must have something like 25 million or so. And so I think we have to be conscious of that as well.
Yeah. So then Matt, how does it differ for you? So two different organizations, different DNA, right?
Yeah, I mean, and so, the way that we think of it, I don't think that it changes at the end of the day. We're still one of multiple payers that our providers are working with and are part of the network. And so the incentive alignment is still very critical to what we're able to do. Luckily for us, given the position that we are in, we do have fairly substantial value-based arrangements that are in place. So when you think about the financial and the clinical risk that's associated with that, it does create a platform for that conversation. But as Paul and I have both talked about, it's still very critical to really meet providers where they are. And so for us, it's about aligning some of those early use cases with, what are the key pain points that the providers are seeking to address? And whether that's, purely a provider experience play, are we talking about issues as it relates to their quality measures as part of that value-based arrangement? And every conversation with each provider is going to be slightly different, and therefore our priorities will be different, but we're looking to create some sort of commonality across all of those various conversations.
Okay, cool. One just came in. This is this may or may not be in either of your wheelhouses. So if it is, we'll take it. If it's not, we'll pass.
Thanks for giving us an out. I appreciate
the advance out. The advance out for sure. It's the only way to do Q&A, Paul. What does your roadmap look like on the pharmacy benefit side? I'd love to hear any update on APIs for pharmacy pricing. particularly any comment on NCPDP versus FHIR?
Thank you for the out. I think that's
All right.
a highly specific question, at least on my side.
It is very, very specific, but didn't know if you knew anything. Matt, same for you?
Yeah, unfortunately, I've got nothing either. At a high level, there are some explorations into kind of the benefits check component, but as the details around pricing, I'm not privy to that.
Okay. Well, we'll take credit for asking it and taking a pass at it. Maybe just back to working with providers and having them seeking their collaboration with you. You guys as the health plan, when you're analyzing these types of initiatives, you're going to be looking at certain KPIs. Matt, you said it in one of your comments around specific metrics and specific actions that you're looking to influence. The provider, I assume, is looking for something as well. Are those KPIs always aligned, or how are they looking for something different than you? How do you guys think about that?
So kind of going back to how we break it down, right? We're going to prioritize those use cases that are mutually beneficial to start. I think when you think about overall KPIs, right, I think as an industry, we refer to, consumer member NPS, and then what are we doing to really drive down overall medical cost trend? But then when it gets into the tactical use cases, and I think the point made earlier was we're still learning so much about what we could potentially do. And so inherently, as part of the use case implementation, you're going to see very operational metrics. So looking at the number of patients who, picked up a medication, the number of patients who went and got a lab test done. And so those are going to be our leading indicators. And then ultimately, when we think about the outcomes metrics, are lagging indicators, that's where we'll really start to focus more on medical cost savings, overall utilization, and how we're potentially bending the trend there.
Yeah, I think that's exactly right. To keep it simple, Nolan, there's value creation and there's engagement. On the value creation side, there's a lot in there, right? There could be MLR savings, there could be patient outcomes and adherence. And then on the engagement side, a lot of the stuff that we're doing, we want to make sure it's being used. And so if you take like a Smart on FHIR app, okay, great, we're collaborating. They installed the thing, but no one's using it. And so I think like how often are provider partners, when they're seeing an Oscar member or, Oscar patient, actually leveraging the information? And if they're not, we'd have to iterate because that's sort of another leading indicator on, the ability to have that downstream value. And I think the other thing that's like extremely complex is the user is often not the buyer of the arrangement, right? And so you might be agreeing to doing really innovative things with the leadership of a system, for example, and then there's the dissemination of an initiative to a physician that's using a capability at the point of care. And while you hope those are always aligned, those are just different individuals. And so I think we have to be thoughtful in terms of, striving for KPIs that create value for all of the audiences, both on the provider side and on the member side.
Yeah. Yeah. Well said. I have the pleasure of getting to work with both of you, in different environments. You two have very important and influential jobs at some of the most important and influential healthcare companies in this country. And, being on the product strategy and partnership side, Paul, on the analytics and behavior change side, Matt, you guys see stuff that a lot of people don't see, and you're doing, projects and initiatives that are certainly driving change. So thank you for the work you're doing in the roles you have. Thank you for joining us today, sharing some of your perspective and some of your trade secrets and your perspective on, no trade secrets were shared, I know that, and your perspective on collaboration, going forward, and hopefully what these new FHIR standards and the new infrastructure taking place on the payer side, the health plan side, can start to really map to some of the infrastructure that's on the provider side. and should be an interesting path forward. So thanks again, guys.
Absolutely. Thanks for having us.
All right. Take care.